Now that Tommy's condition is improving, his parents meet with the team to develop a new plan. Transition to rehab for a few days, and then discharge home as soon as he is able. His parents are surprised at how quickly things are happening, since he is still in a lot of pain and isn't walking easily. They worry that this will be too much too soon. Tommy's parents feel nervous at the thought of taking him home. They worry about the equipment and medicine he will need, and whether they have the skills to care for him. Tommy's doctor asks if he's ready to go to physical therapy so that he can get ready to go home, and he says, "Yep." Even though Tommy wanted to go to physical therapy, he was not prepared for how difficult walking would be. He imagined that he'd just lie in bed until he felt better, and then get out of bed and start walking again. The first time he tried to walk, he got upset. The next time, he got angry with the physical therapist. Later, Tommy told his therapist that he had been having nightmares about being chased by a car.
Hi Tommy, I'm Carla from Physical Therapy. Do you remember me from yesterday? Well, today we're going to be working on walking with your crutches so that you'll be able to go home soon. Are you ready to get started? Oh, you look pretty mad. I guess you might be a little bit angry with me for making you walk when it's still so painful. I know this must be difficult for you, and you worked really hard yesterday. It must be frustrating to not just be able to get up and walk. Yeah, it is frustrating, and it's painful too, I know. But here's what we're going to do. We'll have you walk from here to the end of the hallway and then come back. And then you can tell me how you're feeling. And then you can help decide if you're ready to do a second lap or not, okay?
Unlike adults, children live in the here and now. While adults understand that painful or difficult treatment can be beneficial in the long run, many children cannot see beyond their pain. In addition, children have less natural ability to tolerate frustration or cope with pain. As a result, it is common for children to get angry at healthcare providers, to become uncooperative, or to experience emotional meltdowns when challenged to do something that is painful or frustrating. In working with traumatized children, it is helpful to enter their here and now world. Understand that their emotional reactions will not typically respond to logic or reason. For many children, being disabled, having to look at scars, stitches, casts, or losing their hair, even if temporary, are reminders of the trauma and can trigger emotional reactions. Trying to convince them that it will be all right in the future is usually not effective. Validate their frustration and acknowledge the impact of the trauma on them, even if you know it's temporary. Remember that school-aged children and adolescents can be very sensitive to looking or feeling different. They will especially worry about what their peers will think and say, and will often withdraw if upset, rather than face others. Pain can also trigger children's traumatic stress reactions. Healthcare providers and patients should work together to develop strategies in advance to deal with pain. Research suggests that while a child is going through a painful procedure, distraction is usually most helpful. Surprisingly, providing a lot of emotional reassurance in the middle of a procedure does not help children cope. Encourage them to play games, watch a DVD, listen to music, or just talk about things they like. As much as possible, allow the child to participate and provide some control over what is happening. For example, you can allow them to choose whether the dressing change will be before or after lunch. Even though kids live in the moment, planning in advance is important and should include identifying children's coping strengths and resources, as well as barriers that will hinder progress.